out of here with such incredible hands-on training and you're gonna work. This is a rigorous program, but you come out being able to handle so many problems and obstacles that come your way that you may not have experienced elsewhere. And that, I think, is invaluable. I heard from upperclassmen in my program and just word of mouth after working with other attendings throughout school and going to conferences that it was a rigorous program, autonomy for sure, a lot of hands-on exposure and surgical training.
This program is pretty renowned. Lots of people across the country are pretty familiar with it, believe it or not, before they even get here to rotate with us as medical students. We have just a high volume here in the hospital, high acuity level, so these residents are getting a ton of exposure, and that's pretty well known across the country.
Everything that we teach and approach with is with academic backing and experience-based, and so you get hands-on autonomous training with close observation. This includes not just diabetic Charcot reconstruction and trauma, but elective forefoot, bunion, hammer toes, rear foot, and ankle reconstruction as well.
We want everything to be a hands-on experience. We want you to struggle a little bit. We want you to grow. You learn more from hard cases than you do from easy ones. We want to let you learn and incorporate things we've talked about to make you better. The benefit to our residents with our patient population is it's widely variable, small problems, big problems.
We're really getting access not just to trauma. That is true. This is a level 1 county trauma hospital. There's plenty of trauma, which is unique for a lot of the programs out there. Our residents are able, and they get so many opportunities to do some of the worst traumas out there, so they feel very, very confident with trauma when they leave. But also, it's not just trauma. We do a lot of diabetic limb salvage here, but then also we just have a very broad patient population in general, and so really across the board, they're exposed to basically every facet of foot and ankle surgery, and the high volume, high acuity. When they leave here, they are really trained to do darn near anything.
In a lot of places, there's a really bad turf war where foot and ankle, like podiatry, we don't get to do a lot of the big trauma cases because ortho's very dominant or they do it all. But here we have a great relationship with them.
Not only do we work with them every morning and every day in the office, we can bounce ideas off of them. I've had times where I pull up an x-ray and I ask some of the other orthopedic residents just, hey, what would you do with this? What are your thoughts? Or what do you think about this plan that we did? And they ask us the same thing too. We've had cases where the orthopedic attendings ask our attendings and they scrub together and do the same case or just ask for pointers. And I think that that's very rare across the country, and I love that.
Bottom line is it is busy. We do a lot of work. There's a lot to be done, especially with such a small team, but I think the rewards are, uncanny.
You have a limited amount of time to become the surgeon you're going to be, and so you need to put all of your efforts into this time frame. But that baseline training, whatever you get, is what you're going to build on. And so at JPS, pretty much all realms of foot and ankle pathology we treat here, and we have extensive numbers and training.
But that's what I wanted. I was like, give me the hardest possible scenario, because I feel like if you learn how to treat those patients, when I go out on my own, you're prepared for it for sure.
You get one shot at residency, one shot. And that's where your surgical training is going to come from. That's where the bulk of your medical training is going to come from. So it's very, very important that you really look at the breadth of training that you're going to get and make sure that you're getting a program that is going to cover all of your bases, right? And I would strongly, strongly tell you that JPS is a program that our residents, they are very well trained after the end of their 3 years in all things foot and ankle surgery. They are well prepared. They go on to have very successful careers in foot and ankle, and that to me is proof in the pudding.
Coming through this program, you learn not only, again, the textbook answers, but real life and how to treat these people, and that was invaluable to me.
And this is, the best program in Texas.